Hello everyone, I'm Marvin Plackett. Greetings to all residents, to all staff, and to all guests. Today is Thursday, January 28th. I sure hope you are doing well. At this time, we have only one active COVID case. No residents, and it is one staff person, and of course that staff person is at home recovering. So it has been quite some time now since we've had any residents with COVID, and we are really delighted about that. And that, of course, is a result of the strong commitment and efforts of everyone here at Episcopal Homes, to all residents and all staff. So we thank you, and we're just delighted at how well we are doing. A lot of our colleague organizations are not doing nearly as well, and so we're doing a number of things right, and we have to keep it up. The vaccine is here. As I mentioned last time, we are delighted. By the end of next week, all of our communities and all staff will have had the opportunity to have their first round of the vaccine, and some will have already received their second round of the vaccine. And so we are delighted. We are very fortunate. Of course, we're part of that Group 1A, the high priority group as defined by the Minnesota Department of Health. So we're delighted. And if you have any questions about that, contact the manager of your community. It's going well. You know, the teams, when they come from Walgreens, CVS Pharmacy, they're well organized, it's well orchestrated, and there's excitement in the air on those days when their teams are at our various communities. You know, the place is abuzz, and it's wonderful. It's yesterday I felt giddy. They were here yesterday, the team right here in Otto Hall, and there were 270 vaccines given yesterday. 270. It's wonderful. If you've been listening, of course, to the news over the last 24 hours, 48 hours, and so forth, you know that Dr. Fauci, that Dr. Mike Osterholm, and other national experts and local experts, they are saying that it is going to get worse before it gets better. Pay attention. We all need to pay attention to that. I'm not the scientist. You probably aren't either. That's why we pay attention to what the scientists are saying, what the epidemiologists are saying, what those researchers of communicable diseases are saying. And they're saying it's going to get worse before it gets better because we have these new strains that are more contagious. And so over the next few weeks, and we'll see, maybe over the next few months, it's going to become more challenging than it is right now. That's the reality. So what can we do? What you're already doing well, and that is wearing our face masks. We cannot let up on that. We cannot become complacent. We have to wear our face masks at all times and wear them properly. And that means over the mouth and over the nose, wearing it properly. And we have to physically distance. We have to keep up these measures for at least the next several months. We don't like it. We're growing tired of it. We are tired of it. I so understand. That's exactly how I feel. But I'm not going to let up. And I ask you, do not let up. Okay? We must employ these measures. So, with that, I'm going to wrap up for today. And remember, look out for not just yourself. Look out for your neighbor. Look out for your loved ones. Check in. How are they doing? Make someone's day, all right? So I will be seeing you on Monday next week. That will already be February. Here we are, almost the end of January. Amazing. And now for some positive words for us. Looking forward to hearing from Jean Doan and her dog Reggie. Jean lives at, well, Dan, her dog Reggie. They both live at Cornelia House. Welcome, Jean.
Good afternoon, everybody. I'm Jean Doan, and my husband and I moved into the terrace back in March of 16. And this was after he had been in TCU for 6 weeks. So we appreciated being able to finish his recovery from surgery. And then he thought, because he thought I had so much work to do for him, that I should have a dog. And so therefore I got Reggie. he came here in, I think it was, around my birthday in May. And he was a breeding dog, and the breeder, of course, doesn't need a old dog. So it was good that I took him, and he's been absolutely the most wonderful resident of Episcopal Homes that you could imagine. More popular than myself. He's made friends much more easily. I am now living over in Cornelia and have been there since January. And of course, we've been quarantined, started in February, and right up till today. And it looks like we have maybe 2 or 3 more months of this, but there looks like light at the end. We'll be soon having maybe the regular program at Episcopal Homes with restaurants and activities and gatherings again, and that'll be so great. I have a little dog story. This is a book called The Dog at My Feet. Well, anyway, this gal, her name was Kristen, and she had 6 weeks to go before she was going to go to college. And her friend's dog had had puppies, and they were ready to be given to homes. And so her friend gave her a dog. And she said, well, and her mother said, well, who's going to take care of the dog when you're gone? And she said, well, maybe I could take the dog with me. And her mother said, well, that is really ridiculous. And she said, well, can't you, wouldn't you really like to have a dog, Mom? She said, no, I'm getting a new house and we're downsizing because you're going off to college, and I want to do other things. So guess what? She thought, oh, I got 2 grandmas. I'm going to call them. Well, the one grandma said, no, I got a parakeet and I really don't want any other pets. And the other grandma says, well, no, I don't think so. So anyway, she said, well, I guess I'm going to have to give my puppy back to my friend. And just then, Grandma Margaret called, and she said, well, maybe I'll try having a dog. It is lonely around here. And so that's what she did. And the dog was with her, and Margaret said, if I didn't have, I don't know what I would do if I didn't have this dog. That's kind of the way I feel about Reggie too. Gets me up in the morning, got to feed the dog, so I have a purpose and something to do. And then we go for walks and we get our exercise, and that keeps us going too. And then when her grandma got Alzheimer's, the dog just seemed to be so comforting to her because she could tell the dog stories, and even if she couldn't remember her grandkids or her daughter's name, she always remembered her dog. And when she got really bad, then of course it was the fun of taking the dog to Grandma to visit, and of course then guess who took the dog? Mom. And so anyway, they realized how much that dog had contributed to the whole family. The fun of going home from college and seeing the dog and having the dog, and Mother realized all the advantages too. And so it's, I think having a dog, I know for myself, it's absolutely wonderful. I've always wanted a dog, and I used to coax dogs home, and then we would put ads in the paper to find the owners, and I kept wishing, oh no, hopefully they won't ever see the ad. And of course they always did, and I would have to go through the grief of having to give up this puppy that I thought I could have. But anyway, Reggie's been my dog for 5 years, and we're aging together, and we're hoping that we can last together.